Good evening, friends. Today, I thought that I'll just talk briefly about what I know about the ethics behind this art of medicine. Medicine is an art as well as a science. Very, very important. The thing is that everyone should be knowing about the Hippocratic Oath. Unfortunately, I find that when we completed our MBBS, we were supposed to recite the oath and then take our degree. I don't think it is happening anymore. But the basic gist is that I'll be straight, I'll not cheat, I'll not do something which I don't know, I'll not abuse women, men, whatever, rich, poor, no discrimination. Most important of all, I will give respect to my teachers and teach this art to their siblings, not charge anything from them. It goes like that. I think those who are interested have to go through the Hippocratic Oath, Greek. So, very important. But see, I've got a few patients whose children are studying MBBS, and I don't take fees. I'm not telling out of pride because that is how it should be. But I've seen doctors taking fees from my own father when I was there as a doctor also. It doesn't matter. But it is an individual choice which one has to do. Very important, this profession. This profession, I came into this profession after having joined engineering with my father with a heart attack, with the intention of having to know everything about cardiology and whatever and to treat him, and not with the intention of name, fame, or money. Unfortunately, it is going the other way. It is for name, fame, money, and the doctor patient relationship. I've been speaking about that. What little I know. No one knows everything. One thing is very, very important. No one knows everything in this. Somebody says he knows everything, authority is lying. I mean, humble people I have come across, Dr. K.P. Mishra and all. They were different, but towards the end, spiritual, and then tell Dr. K. I'll never forget his initial thing that I know everything, and several years later, drawing a big circle and putting a dot and telling that if cardiology is such a big circle, what I know is a dot. That was the change. So that is true. So this also goes without saying is that if I don't know something, I've got to refer. I should not keep on making the patient, experimenting with him, making him money, making money out of him. That is very important. And as a physician, we have got a physician's prayer, which is there, which is one of the best gifts or compliments or whatever, which I got years back, still I hold back with me. Many things I give away. It goes like this: Dear Lord, thou great physician, I kneel before thee, since every good and perfect gift must come from thee. I pray, give skill to my hands, clear vision to my mind, kindness and sympathy to the heart, my heart, strength, give me the singleness of purpose. That is, I should not deviate from what I am doing there. My mind should not be elsewhere when I am treating a patient. That's why I say that I switch off my phone or put it in silent mode when I am with the patient, just to be full concentration on the patient. I also experienced the other way around when I was with my father, taking a thing. It doesn't matter. Those are experiences from which sometimes we learn what not to do also. So give me singleness of purpose, strength to lift at least part of the burden of my suffering fellow men, and a true realization of the rare privilege that is mine. It's a very rare privilege becoming a doctor. It's a gift. Should be thankful to God. And this gift should be used in the right way. Of course, definitely no doctor suffers, no doctor goes penniless. So there should be, should be in mind that God will provide everything if we do what we need to do as a doctor. Take from my heart all guile and worldliness, that with a simple faith of a child I may rely on thee. This prayer, wonderful prayer, making us realize we are human, humble, and noble profession next to God. I can give you a couple of examples. Several times I've told my patients, see, I've got same problem, diabetes, I've got a heart problem. This is, sir, how can you as a doctor get a heart problem? How can you be having diabetes? I said, I am human. Like everyone, one day I'll be going up. So the patients feel that the doctor is immortal. That is almost thinking that he is equivalent to God. When they come with that trust, betraying that trust, or knowingly cheating a patient and generalizing nothing particular to anyone, I feel it is more criminal than a murder because they come with trust. Of course, I can charge my fees, but then it's left to an individual. I look at the patient. When I see a pensioner getting 3,000 rupees and I am writing medicines for 6,000, I, having gone through all these on the other side, I know. I probably say no to my fees and then give him some samples. And that act of giving gives a satisfaction which cannot be described, undescribable satisfaction. And then I should also know to draw a line because I've got to live where. And I can only decide, okay, a person can afford. I've spent 1 hour with him. I've explained everything to him. It's the responsibility of a doctor. When I'm writing a prescription, name, age, on top the diagnosis, the whole medicines in capital letters before food, after food, and explain. Where to explain the side effects, to whom to explain. If you tell an elderly some side effects, they'll be coming back with that. If you have some cramps after giving statins, next day they'll be back because they'll be anyway having generalized aches and pain. So whom to tell? A relative. That observe if there are any issues. Talk about this, the medicine, how long it takes to act, how it works, certain medicines, and then down the other things, review, when to come, what those things, and then all explained. If the patient is not willing, needs admission, not willing, patient advised admission, not willing, everything to protect ourselves. Very important this. So all these are mandatory, it takes time. And then this all goes with the territory. Very, very important in this. So what I am trying to stress upon is education in our country should be different. In the medical field, especially, it is with lives, should be strict. They should know at least something in the sense that what not to do at least. That is, if I don't know about a diagnosis or something, I cannot make the patient keep coming and then writing something and giving. I should be referring. Very important. Not play with him. That is very important. So there are many things. Patients, when they are going out, they should go with a satisfaction of, and we get a satisfaction of having done something which is really expected out of us. That satisfaction to satisfy a doctor's conscience. So very important, medical ethics and following this is very important. Because why I'm telling all this is, see, a doctor, when he does something, finds a diagnosis, treats, everybody becomes well, they praise and go to the highest level. We should know equanimity because same doctor, simple, because even if it is not due to his own fault, something goes wrong with the patient, he can be criticized. So life is a great leveler, so you've got to be ready, be balanced. Okay, right. Fine, I did a good diagnosis, excellent, others missed. Fine, satisfaction. But I should realize that tomorrow things can go wrong also. That is where that faith, clarity to the mind, because so much of studies into the head can only confuse the head of a human being. So when I'm looking at a patient, getting the history, coming to a diagnosis, confirming with the investigations only if required, I've got to explain to the patient when I'm telling this investigation I'm writing because of this reason. Then the patient is not going to tell that when the investigation comes negative. I've seen patients telling, sir, they asked us to do an MRI, it was a waste, it was normal. We do tests to confirm it is negative also sometimes because the patient's anxiety, tension, worry, we tell them, see, we are doing, I did it day for yesterday to a patient. Patient was worried because of giddiness, I might have a brain problem. Told that, okay, Because this patient is going to continue having, because it is motion sickness, they might go somewhere and then worry, no sleep, panic attacks. So to clearly explain in black and white that your brain is fine, and sometimes non-patients you can say that you can be sure that you've got a brain also. So a little bit of humor. There is only, you can do it only with people whom you are familiar with. Fine. All this and the reason behind the investigation is why to do. Why to do a masteral checkup? Because we have all prevention. This, when you explain all this, practice becomes interesting, patients understand, and then they realize the genuinity, and then they don't complain. So with this I'll finish this vast subject, interesting, wonderful. There's a saying that if you enjoy what you're doing, you need not work for a single day in your life. There is it becomes like a hobby, enjoying yourself, watching your cricket match, if you enjoy what you're doing. And this is, a doctor's this thing is exercise to the brain. And the clarity of diagnosis, everything is given by some higher power, whichever God it is, or some supreme power is there somewhere, which is giving this. Because I was taught by my doctor, Professor T.K. Ganesh, I will never forget what he told. Whenever I pick up my stick, I pray to God. Today, whenever I pick up, I tell, oh God, let me not do harm to the patient. Please, you are doing this, not me. Honestly, every time. That, because I've seen actors when they are having their makeup, they pray first and go. Even the great Shivaji Ganeshan, he used to drink only after removing his makeup. So all these are the qualities that go on with the territory in each profession. And thus I feel it is very important for doctors to think beyond studies and use the theory into practice, comes with experience, learn from K.P. Mishra. Dr. K.P. Mishra said that don't look into the pocket of the patient. See, when I'm seeing a patient, somebody with pension of 3,000 rupees, the fees, what do I say? It doesn't matter. I am not rich. I hardly have little, but doesn't matter. Satisfied with what God gives. He takes care. Because needs are taken care of. Wants, it is like an addiction. It will never end. You want more and more and more and more than everything. That's what I feel. So, 3,000 rupees pensioner living on that. If I write 6,000 rupees medicine per month, what will he do? He needs that also. So I'll say, don't take my fees. I give him some samples, and that satisfaction of having done something, no need to tell anyone, it's undescribable. And then again, fees is decided by a doctor. If I think patient can afford, I spent 1 hour with him. I can probably increase the fees because I have got to survive. It is a balance. So that goes, and the patient should go with satisfaction that yes, doctor has done something for me to give that fees, and he should do it willingly. So these are the things which come in the art of medicine, which should be brought into the medical curriculum. How to deal with the patient, what to tell the patient, how to tell, especially death scenario, how to put it across, whom to tell, not to an immature boy or a child. Somebody mature, this is the situation, get ready. Don't go and tell the patient that you are very critical. Patient will immediately, heart rate goes up, things goes up, it becomes worse. So where to do what is also very, very important, which you learn. When you talk to your professors, teachers, you learn a lot. Sometimes you also learn what not to do, like in life from people. So I think I'll conclude with this. Hope I have not been boring you. Anyway, have a wonderful evening.